Welcome, everybody. As folks are joining the webinar, we're going to give it a minute or two, let everybody get in. So just sit tight with us while we wait for everyone to join from the waiting room. Okay, so we'll probably still have people joining us, but we want to get started. So it's the top of the hour. I'm so excited to have everyone here with us today. If you don't know who I am, my name is Kate Keltz. I work with the Children's Tumor Foundation in patient education and engagement, and I'm very happy to be everyone's host for this fabulous information that we're going to bring to everyone today. So thank you for taking the time to be here. A few quick things, housekeeping and whatnot, before we get started. So today's webinar, How to Tell Your Child About Their NF1 Diagnosis, we're very proud here at CTF to be presenting this information and these new educational resources that have been created as the result of really great teamwork. So we're happy to be bringing that to you today. Closed captions are available. You just need to click the CC button at the bottom of the screen to get those turned on. If you're having any trouble with that, please drop something in the chat and we will get you figured out. We are also recording this event and it will be made available on our YouTube channel to the public. So if you have to leave early or you know somebody that is missing out on it, please let them know that they will be able to view it later. And also, we do have a Q&A as part of the webinar today. That button is at the bottom of your screen. As our speakers are going through the material, please feel free to go into the Q&A, ask your questions. They'll be responding in there, but then we'll also reserve some time at the end where they can bring a couple of questions that maybe were asked several times or people were particularly interested in hearing. They'll bring those questions and all three panelists will have a chance to respond right at the end of our hour together. So having said all of that, I'm very pleased today to welcome our speakers. We have with us today Dr. Ashley Cannon, who's a clinical program manager at InformedDNA and the research project coordinator at the University of Alabama at Birmingham in the genetic counseling program. As a clinician scientist, Ashley has worked as a genetic counselor in the neurofibromatosis clinic at UAB, coordinated NF1 clinical trials, performed research focused on cutaneous neurofibromas, and was awarded the Francis S. Collins Scholars Program in NF clinical and translational research. Today, Dr. Cannon will be joined by two of her previous genetic counseling students who were both involved in the work that led to what we're going to hear about today. Madeleine Franchi is a pediatric genetic counselor for the University of Florida Health in Jacksonville, Florida. She completed her Master's of Science in Genetic Counseling at the University of Alabama at Birmingham in 2022. Her student research project there focused on perspectives of parents disclosing a pediatric NF1 diagnosis and was published in the Journal of Genetic Counseling in 2023. We'll also be joined by Ryan Brown-Ezell as a pediatric genetic counselor for the University of Florida Health in Jacksonville, Florida, where she's currently working. She also completed her Master's of Science in Genetic Counseling at UAB in April of 2024. Her student research focused on children's books about genetic conditions and the NF1 disclosure process. So expanding on Madeleine's findings, Ryan led a partnership with CTF to create a caregiver resource and children's book to support the NF1 disclosure process. Additionally, she and her team created an online and up-to-date repository of children's books about a variety of genetic conditions. So having said all of that, I'm going to hand things over to Dr. Ashley Cannon and let her get us started. Thank you, Ashley.
Hi, Kate. Thank you so much for the kind introduction and for allowing us to share these wonderful resources with the NF1 community. So hi, everybody. I am Ashley Cannon. And so I'm just going to give a very brief background and timeline about all of the work that has been done previously and that we are going to be talking about a little bit more in detail today. So if you don't mind scrolling 2 more slides in for me. There we go. Okay, so after my very brief intro, I'm going to pass it over to Madeleine. She's going to talk about her NF1 disclosure study Then we're going to pass it off to Ryan to give an overview of her resource creation, and then she's going to provide a little bit more detail about each one of these resources. So specifically the caregiver guide components, and then she's actually going to read Super Emerson, the companion children's book at the end. So super excited to hear that. Okay, so the next slide is a timeline of all of the work. I started working with Dr. Bruce Korf in the neurofibromatosis clinic at the University of Alabama, Birmingham in 2015. And we saw pediatric patients as well as adult patients. So we followed individuals, throughout the lifespan. And there were different NF1 concerns at different stages of life. And one of the more common concerns that I heard in the pediatric clinic was from parents. And they would tell me that they really struggled to tell their child about an NF1 diagnosis. And then there were other families where it was never a conversation. It was just a part of their family's story. So I was really interested in better understanding who is telling their children about NF1, and for those that are, what works, what didn't work, and for all parents, what resources would help them talk to their children about NF1. So I proposed this as a research project idea to the UAB genetic counseling students. They have a required research component for graduation. And thankfully, Madeleine Franchi was a student at the time and expressed interest in this project and in this topic. So she began work on the NF1 disclosure study in the fall of 2020. And then based on the results of that work, Ryan began working on the parent and child resource with the Children's Tumor Foundation in the fall of 2022. Then in the spring of 2023, Madeleine's disclosure study was published in the Journal of Genetic Counseling. And now, as of this month, we're very excited that the parent and child resources are going to be released by the Children's Tumor Foundation. So I wanted to share this timeline with all of you just to emphasize that this was many years of hard work and there were many, many people involved. And I am so very thankful that Madeleine and Ryan were so very interested in better understanding the needs of the NF1 community and trying to address those needs, because I definitely would not have been able to do this on my own. So very, very grateful. And with that, I'm going to pass it over to Madeleine now so that she can talk about her study.
Thank you, Ashley. So yes, just to echo what Ashley said, I also wanted to thank not only Ashley, but also the other members of my research committee as well. And there was a lot of hard work and support that went into this project. And I know I definitely couldn't have done it or completed it and gotten it to this point without them. So without further ado, I'll go into some more details about my NF1 pediatric disclosure study. Okay, so I did just want to review briefly the definition of disclosure and more specifically diagnosis disclosure. So disclosure is defined as the process of communicating information about a diagnosis, such as natural history, inheritance, management, and expected outcomes to patients. And to give you some background on the NF1 disclosure study, what we realized both from Ashley's clinical experience in the NF clinics as well as a literature review is that there was some information out there about how to disclose genetic conditions to children in general, but there was a lack of literature about disclosure of an NF1 diagnosis specifically. And there were a few reasons why NF1 in particular was interesting to us and why we wanted to pursue a study on disclosure for NF1 specifically. And one of those reasons is that NF1 is a highly variable condition, meaning that not everybody with the diagnosis will experience the same symptoms and the same severity of those symptoms. And it can also be an unpredictable condition, meaning that even if we are able to find a genetic reason why somebody has NF1, that doesn't always help us predict exactly what symptoms they'll have as part of that diagnosis. And another factor about NF1 is that about 50% of the time, somebody might be the first person in their family to have a diagnosis of NF1. So if the whole family is learning about this condition for the first time together, that might be something that makes disclosure difficult. And so that, in consideration with known general disclosure concerns, made us want to study NF1 disclosure specifically. So what we already knew coming into this study about general disclosure concerns were that overall parents felt a lack of support in disclosing diagnoses to their children. They felt like they had limited knowledge about the condition to be able to effectively disclose. Parents also reported feelings of guilt and fear surrounding their child's diagnosis, and parents also considered family dynamics in the disclosure process. And together, all of these factors led us to our study, which is titled Parent Perspectives on Disclosing a Pediatric Neurofibromatosis Type 1 Diagnosis. So the purpose of our study was to evaluate the concerns, barriers, failures, or successes parents or guardians have experienced when they have or have not chosen to tell their child or children about a diagnosis of NF1. So these are the three main ways that we recruited for this study. And I did also want to thank the Children's Tumor Foundation, as they were a major source of recruitment for our study. So I appreciate your support of our research efforts. And we mainly recruited through the NF registry, through the Children's Tumor Foundation. There was also a physical flyer that we distributed to NF clinics in the Children's Tumor Foundation NF Clinic Network. And we also did a social media post to the Children's Tumor Foundation Facebook page. Our study consisted of both surveys and interviews. So we had a total of 258 parents complete surveys. And out of that 258, we selected a group of 20 parents to then complete an interview. Out of the group of 20 parents, 12 of those parents had disclosed a diagnosis of NF1 to their child, and 8 had chosen not to disclose that diagnosis. So to briefly review the results from our survey, we found that the majority of parents reported disclosing a diagnosis of NF1 to their child. So we found that 182 parents, or about 70.5%, disclosed the diagnosis, and 76 parents, or 29.5%, did not disclose the diagnosis. Overall, we found that NF1 disclosure was more likely if a child was affected by a severe complication of NF1, and a severe complication was defined as having a plexiform neurofibroma, a malignancy, or a learning or cognitive disability. We also found that our average age at disclosure was 5.1 years, so this was occurring relatively early in childhood. And these are the major themes that we contrived from our interview responses. And so we'll focus on 3 of them today, but I did just want to include all of them here. So our main themes were disclosure concerns, factors affecting disclosure, parents' approaches to disclosure in the disclosure interview group only, disclosure discussion, desired resources for disclosure, and disclosure recommendations also in the disclosure group only. So for our first theme, these were capturing parents' concerns that they had about disclosure. So like we mentioned earlier, a lot of parents expressed concern about the complexity of NF1 itself, the unpredictability of not knowing exactly what to expect in the future, and concerns about heritability, meaning not only a child maybe being the first person in their family to have the diagnosis, but also questions about future children as well. Parents also mentioned their own personal emotional struggles when thinking about this diagnosis and discussing it with their child, and also any physical struggles that their child might be experiencing that may impact how and when they choose to disclose this diagnosis. A lot of parents also mentioned that they were afraid that disclosing this diagnosis might impact their child's outlook on the rest of their life and things that they might be able to achieve in the future. And I chose this quote from one of our parents in the non-disclosure group that I felt really summarized all these concerns. So they told me that I think that's difficult, the fact that it can be progressive and like obviously more difficult health concerns or more serious health concerns that can arise from it over time. So this just kind of summarizes all the concerns that parents have going into a disclosure of NF1. Our next main theme category is desired resources for disclosure. So this was a really great opportunity to hear from both parents in the disclosure and non-disclosure group about what they felt like would be helpful to them through their disclosure process. So a lot of parents reported that they felt like they needed more education and information about less common features associated with NF1, as well as reproductive risks. Parents in both groups actually mentioned the need or desire for a children's book that they could use to help guide not only their child, but also them through the disclosure process as well. And along those lines, a lot of parents express the need for support and guidance for what specific topics about NF1 to address and when, since there are different topics that might be appropriate for children of different ages and developmental levels. They felt like there was a lack of guidance on that part of disclosure specifically. And then finally, parents also mentioned that they would really value from anecdotal accounts from parents who already had disclosed, just to learn about what strategies worked well and what things they wish may have gone a little bit differently during their disclosure process. So I chose a quote from one of our parents in the disclosure group who said, "I wish I had some kind of children's book or something that she could read right then and there." So it was really some ideas from this theme that led us to our next part of the project, which Ryan will talk to you about a little bit later, which is, of course, the creation of not only the children's book, but the caregiver resource as well. And our last interview theme is disclosure recommendations. And so overall, parents really expressed being open and honest with children during the disclosure process. They also emphasized the need to normalize the diagnosis, meaning letting their child know that they're not alone and that there are other people out there who are affected by NF1, and to always maintain a positive attitude and a positive approach to disclosure. Parents in the disclosure group also expressed that no single approach is going to be best for everyone. So this just kind of captures that idea that there are different factors that might impact each family's individual disclosure process, and that it's important to consider some of those factors like family dynamics or child's personality when thinking about how to disclose. So for example, if there is a child who already has anxiety about health-related concerns, that may impact the way that a family chooses to disclose an NF1 diagnosis. And then finally, parents in our disclosure group recommended limiting online searches and avoiding worst case scenario thinking when it comes to NF1, which we felt it would also be important to create, an informative resource that parents could also use to help start their information and disclosure journey to their child. So I picked this quote from the disclosure group to kind of capture all the different factors that can go into disclosure. So they said, "I really do think it depends on your child, and I think it depends on the family as a whole, and it also depends on the child's age." So we took all of this information that we learned from both the survey and the interviews, and I'm very thankful that Ryan had an interest in this study and these results and worked to bring both the children's book and caregiver resource to life. So with that, I will go ahead and turn it over to her to talk about her part.
Thank you everyone for being here. I appreciate the time, and I appreciate Madeleine and Ashley for creating all of this work ahead of me. I really couldn't have created these resources without you guys and all the other individuals that I'll have listed later as well. So expanding off of Madeleine's findings that people really needed a resource of support during the disclosure process, we came across something called bibliotherapy. And so bibliotherapy is the reading and discussion of a resource such as a book to help an individual understand and cope with a disease, condition, or event. Bibliotherapy has been previously used in therapeutic resources to help individuals cope, but that is something that we decided could be used with our book as well. And so overall, studies have found that bibliotherapy can help children learn how to deal with a situation from an unbiased perspective and kind of take a step outside of themselves. It promotes an open conversation, whether that's between the reader of the book and the child, or the child and other kids. It can validate children's experiences and also help them not feel as alone and isolated, because they can identify with the character that's also going through something similar. It can be a reminder of support, whether that's identifying with the character or connecting with the person that's reading them the book. And then it can also portray accurate information. So when children try to understand things, sometimes information cannot be completely accurate. And so this can be as a source to correct that information as well. So this has been used in a therapeutic space. We had the idea to use it for our book, but we were not the first one. Someone named Georgina Schlub conducted a study looking at the effectiveness of bibliotherapy in genetic counseling sessions. And she found that it not only helped the children understand information without experiencing trauma, it also put caregivers and parents at ease to understand the information as well. So with that, we got started combining lots of different factors to build the caregiver resource and children's book. We took the inspiration from existing NF1 resources to see what worked and what we wanted to add and maybe make different. And then we also looked at children's book about genetic conditions in general to see how genetic conditions were addressed and what things they made sure to talk about. Those key bibliotherapeutic components, including people or children identifying with the main character and following the main character through a challenging event, was something that was proven by Georgina Schlub, and we could build off of that as well. Madeleine's disclosure recommendations and concerns directly from caregivers was something that parents said they would like to have, and so that is directly included in the resources, along with inspiring different components of the books and guide. And then also Georgina Schlub's compilation of children's understanding of heredity and illness at different ages as well. So we were thankful that Georgina has already done this research to help us understand what do children understand about genetics, specifically genetic conditions at different ages. Together, all of this was what inspired and informed the caregiver resource and children's book. So after we created drafts, it went through several rounds of revision, first through UAB. Y'all recently met Ashley and Madeleine, but also Heather Radke, who works at Children's Tumor Foundation and is also a genetic counselor, was a part of the committee. And then Georgina Schlub, who successfully wrote those other children's books and conducted the research about effectiveness, was on our committee as well. Then after review through UAB, we handed it off to Children's Tumor Foundation, and they had a board that reviewed it, including Jennifer, who's a child psychologist, Suzanne and Vanessa, who are both work at Children's Tumor Foundation, and gave great advice about edits and how to improve the resources as well. We also had parent and child representatives, Stacy and Jackson, were paired together to review the resource and give perspective of what worked and what didn't. And additionally, Connie Sorman was another parent who gave us feedback. Finally, Liz Lantham illustrated the book and caregiver resource and helped our characters come to life as well. I'm extremely grateful for everyone on this slide. We couldn't have done it even if one of these people was not involved as well. So without further ado, I wanted to go through the caregiver guide, or just briefly overview it. The components of the caregiver guide involves reasons to tell your child about NF1. Specifically, we talk about how at that average disclosure age that Madeleine mentioned, about 5, individuals, whether they've been told about their condition or not, realize that there may be something different and they have an interest in their condition as well. So we talk through about the benefits of about disclosing NF1 to your child, and also talk about it can be variable depending on family situation and structure. We go through how to prepare to talk to your child, how to help yourself ahead of time, and kind of get yourself ready for that discussion. Approaches to telling your child, there's not a one way fits all, but we give some guidance on things to think about and factors to include. There's possible responses, whether this is positive or negative, and how to anticipate dealing with those. We break down our advice into developmental considerations. And so this way, at different developmental groups, parents can know, what to talk about when and what things to be more concerned about, less concerned about as well. And then there's also additional resources at the end so that our resource can serve as kind of a jumping off point if caregivers and parents want to learn more information or help their children connect and learn more information as well. The components of the caregiver guide includes advice directly from caregivers of children with NF1 from Madeleine's study, call-out boxes with additional information that add to what's being talked about in the main section, and then examples of what a child might say in each developmental category as well. I wanted to show you guys what the front cover looks like. This is our main character, Emerson, who I will tell you more about in a little bit. And then this is one of our many pages of the caregiver's resource. This is the developmental milestone section for ages 7 to 11. And so you may notice that we outline several different things to make sure to think about and to discuss at this age. At the bottom left of the page, those are examples of things that children might say or the way that they may phrase things at this age. And then also there's that call out box about self-worth at this time, because at this age, children tend to develop a sense of self-worth. So it's an additional thing to think about as well. The children's book was developed alongside the caregiver resource. It involves our main character, Emerson. So this is Emerson. Emerson has ambiguous gender and race, and that was an effort to help them relate to as many children as possible and for as many children to see themselves in this character. There's also a non-traditional family, so you may have seen that front cover of grandpa, mom, cousin, and sister live all together. And this is also to make it more accessible to children who may not have a traditional family setup. Emerson also has visible NF1 symptoms such as the neurofibroma on their leg and cafe au lait spots on their arm and other leg as well. The targeted parent concerns directly from Madeleine's study include the NF1 diagnosis dominating a child's identity, stress about learning about their diagnosis, children blaming themselves for the diagnosis, learning difficulties, lack of public awareness, NF1 variability and progression, uncertainty, stress and anxiety management, fear of going to the doctor, and encouragement that children can succeed with an NF1 diagnosis. So these are things that we made sure to address in our children's book. And as I read it after this one more slide, you may be able to point out these different areas. We included sections for children who want to learn more or maybe who are older that don't necessarily, you don't have to read those to understand the main storyline of the book, but it's additional information. And there's also interactive pages so kids can really make this their own and relate more to the book as well. It can also be used as a caregiver and child conversation initiation resource. From Madeleine's study, they found that sometimes it was easier if some conversation was initiated, whether that's by a book or the child brought up a question. And so this can be used as a guide to start the disclosure process and assist caregivers in that way. So without further ado, I'd like to read you Super Emerson. This is our front cover with Emerson on it as well. We start with a note for parents that I'll read to you, but the summary is about customizing it to make it your own. So this resource is designed to help you talk with your child about their neurofibromatosis type 1 diagnosis. It can be used with the Talking to Your Child About NF1 Caregiver Guide to help you decide how and what to tell your child about their condition. This resource is about a child with NF1 and provides an overview of NF1. Please review this book ahead of time to make sure you are comfortable with the amount and kind of information presented. Throughout this book, there will be Spark Facts and More from Moxie sections with detailed and more complex information. Every child can take in different amounts of information at different times. There may be sections you wish to skip and return to later, or maybe your child is ready to read all the information. If you need help navigating what is developmentally appropriate, please consult the Talking to Your Child About NF1 guide or talk with your NF1 healthcare provider. There are interactive activities that can be done throughout the book. Some children find it helpful to do related activities while reading, and some find it distracting. Do whatever helps your child the most. Okay. Hello, my name is Emerson, and I am 6 years old. My favorite color is green, and I like playing basketball with my friends. I have one dog named Lulu and one cat named Oscar. I live with my mom, grandpa, big sister, and little cousin. My sister is 10 and loves dancing. My cousin is 3 and likes playing with his food. Even though we don't get along sometimes, I still like them. What about you? Who are your friends and family? And then we provide this page to the left where individuals can customize who they are, or the page for who they are in similar fashion that Emerson presented themselves. I also have something called neurofibromatosis type 1. It can be hard to say, so I like to break it up into small pieces. Neurofibromatosis. Neurofibromatosis type 1, or NF1 for short, is what gives me the bump on my leg and a brown spot on my skin. And then this box at the bottom right goes through more about genetic information specifically if individuals want to dive into that as well. Some people's parents, brothers, or sisters also have NF1, but I'm the only one in my family. Does anyone in your family have NF1? When my mom told me I had NF1, I was worried I did something wrong. She hugged me and said I did nothing to cause NF1. And then this fact at the bottom of the page talks more about inheritance. Like Madeleine said, half the time it is inherited from a parent and the other half the time it just occurred in a child. Even though there are lots of people who have NF1 just like me, we all look different. I have a bump on my leg called a neurofibroma and many spots on my skin called cafe au lait spots. And then we divide up Emerson with pointing out that cafe au lait spots, that neurofibroma on their leg, but also that wonderful sense of humor and favorite superhero cape. We also, to the right, outline other features of neurofibromatosis for more information. And at the bottom, give a little fun fact about cafe au lait. It's also a type of coffee, and to beware when you talk about cafe au lait spots in a coffee shop. I have loved learning new things like outer space, fashion, and the great big ocean. One day I want to meet a dolphin so we can splash through the waves together. Sometimes it's hard for me to focus in school, and I miss things my teacher says. I get the wiggles and it's hard for me to sit still. Other times, I have a hard time understanding the work. I told my teacher that sometimes we go too fast and I feel like I'm being left behind. She thanked me for telling her and told me to make sure to ask questions if there's something I do not understand. Everyone learns differently, and it may take me time to figure out how I learn best. For now, I get extra help from my teacher so I can learn the things I want to know. And then this Spark Facts outlines how we all have different learning patterns, and it's what make everyone's brain wonderful and unique. But to make sure to tell people if you don't understand something or you need additional help. And then we ask a question about what they like to learn about so that they can identify what interests them. Sometimes people do not know I have NF1, and I get to be the first one to tell them. I tell them that I have a condition I was born with called NF1. It's part of what makes me me, just like my brown eyes. NF1 is the reason I have the bump on my leg and the spots on my skin, and why sometimes learning is hard. But there is still so much I can do. Having NF1 is just one of my superpowers. I also know that unlike the flu or a stomach bug, NF1 is not contagious. The things connected to NF1, like the bump on my leg, might change over time. I could get more spots or bumps, or nothing could change at all. I need to make sure to tell an adult if I find any new lumps or bumps, have pain or itching, or have trouble seeing, or find it hard to do the things I could do before. I wish I could know exactly what is going to happen in the future. My mom said no matter what happens, my family will always watch over me and love me, which made me feel better. I know my doctor will also take care of me. Sometimes I feel excited about what changes will happen. Other times I feel nervous. Talking to my family and other people who help me makes me feel better. Here is a picture of people who I can talk to. And then we leave a little space for children to draw their support system and identify who they can talk to. This is my doctor, Dr. Dawson. I have lots of doctors and they all work together to make sure I'm healthy. Dr. Dawson looks at my eyes to make sure everything is a-okay. Her favorite color is rainbow and she likes carrots. She uses some of the biggest words I've ever heard. I'm pretty sure she makes some of them up. I do fun tests when I'm at her office, like covering one of my eyes and seeing what I can see with the other. Sometimes when I do this, I feel like I'm a pirate. Arr, matey. I get nervous sometimes when I go to the doctor, and I hold my mom's hand super tight. Then I remember I can take deep breaths for 4 counts. 1, 2, 3, 4. Hold it for 4 more. 1, 2, 3, 4. Then blow out all of my jitters into a bubble. I feel better. And then we leave a section for children to identify what things help them feel better or ease their anxiety. Because I have NF1, I go to the doctor more than some of my friends. Sometimes it doesn't feel fair. Then I remind myself that there are other kids out there with NF1 just like me who also go to the doctor a lot. Other kids go to the doctor for other things too, like my friend who's in a wheelchair. My doctors make sure that we do the right test and that nothing is missed. I can point out anything on my body that feels uncomfortable or is new. Dr. Dawson told me to ask questions if I ever do not understand, and she will explain. You can ask questions too. And then we outline at the bottom that children may be the first ones to identify changes in their body and to talk to an adult. And then also their mental health is important as well. So to pay attention to that and get support for those symptoms as well. Even though having NF1 makes me different from some people, I have a lot in common with my friends. NF1 is a small part of what makes me me, but I also love to play basketball, cuddle with my dog, and spend time with my family. These are also a big part of what makes me who I am. Everyone in the world has different superpowers. One of mine is that I know what it's like to have NF1. I can also throw a ball really far, learn new things with my grandpa, give the best hugs, and love with all my heart. And then we wanted to leave a section so that children can identify what their superpowers are as well. The last page connects people to even more resources from Children's Tumor Foundation to help them talk more about disclosure process, especially for children. And then that back cover has even more wonderful illustrations in the summary as well. These resources are going to be released soon on the Children's Tumor Foundation website. They're going to be free to print. They can be printed in color and black and white. We made sure that nothing is missed. And they're also are currently translated into Spanish and French if patients do not speak English. Although I think we're going to talk a little bit more about this later. Y'all are going to get the first access as well. I wanted to send a special thank you to the UAB committee, which I previously talked about, other UAB support, including Lynn Holt, and then the resource librarian, Megan Bell, the Children's Tumor Foundation team that I previously talked about, including Katie Keltz, who helped put all of this together as well. And then a special thank you to the caregivers and parents surveyed and interviewed. You guys really started this research project out with Madeleine and also communicating with Ashley about what you think would help as well. So we couldn't have done it without you. We wanted to open the floor to any questions that we'd be happy to answer.
Lots of questions about access to these resources. So I will leave it to Kate to explain that in more detail. There was also a question about the Madeleine's publication in the Journal of Genetic Counseling. So I did provide that information within the Q&A. So feel free to find it there. If you have any issues accessing it, feel free to reach out and we can get a copy to you if needed.
Okay, thank you so much to all of our panelists today. I really appreciate, I think everyone does, the time that you took to kind of join this webinar and walk us through these things. As Ashley pointed out, there were several questions about access to these resources, so I will kind of go over that right now. We're going to be closing up and finishing up the webinar shortly here. But before we do, the first thing is that everyone who registered for today's webinar, even if you were not able to attend live, is going to be getting an email shortly within the next 24 hours with a first access link to both resources. That they are downloadable, printable, from your own home, and you will get those within the next 24 hours. Starting on Friday, they'll also be available at the CTF website. I'm going to put a lot of this in the chat so you have the links that I'm mentioning as I'm saying all of this. So starting on Friday, it will also be available at ctf.org/resources. Again, putting this in the chat. Hard copies will be available to request at our resource library as well in about 3 to 4 weeks. There's no charge for those. They are available for free. There will be a limited initial run of hard copies, but as I said, they'll be available at our website that you can download and print anytime starting on Friday. And then if you enjoyed today's presentation, I just want to take a moment to encourage you to consider joining us in June of 2025, June 19th to the 21st at the NF Summit, which is CTF's flagship annual gathering for families and patients and communities affected by NF of any kind. It's an event that is close to my heart and that I work hard to put together because this is a fabulous community. And I love to give this opportunity for everyone to be able to be together. A great place to learn, education, and to be connecting with the rest of the community. And lastly, I just want to give a little shout out to the fact that it's walk season here at CTF. Attending a Shine a Light walk is a really fantastic way to get connected with other families in your area. So be sure to visit our website and look for the Shine a Light walks coming to your area so that you can check it out. You don't have to fundraise $1 million. You just get to go and meet other people and see who's in your area. So thank you again to everyone who joined us today for taking the time. And thank you so much again to our presenters, both for being here today and for your really beautiful hard work on these resources. From everyone here at CTF, we really appreciate all of you and wish you a wonderful rest of your day. Thank you, everyone.